Hi, I'm Dr. Miller. Today I'm going to be talking to you guys about some summer safety tips to keep in mind for your kids this summer. First of all, whenever they're going outside, make sure you're always putting some sunscreen on them. Typically recommend that in kids 6 months and older. Typically recommend an SPF of about 30. You don't usually have to go any higher than that because it doesn't provide any added benefit. Usually there are a lot of good mineral-based sunscreens out there, so some things to look for in terms of the active ingredients are either a zinc or titanium oxide. We usually actually have a list up on the bulletin boards in our rooms, so you can always check that out while you're here. The other thing is to make sure that you reapply it every few hours, just to make sure that it stays on, because it does wear off over time, especially if you are taking your kids swimming. It does get wiped off more quickly, so make sure you're reapplying throughout the day. Another thing to keep in mind is like just swimming safety tips, things like that. Please remember that kids can get into trouble even in small amounts of water, so always make sure they're being supervised, even if it's in a small kind of kiddie pool in the backyard, that kind of thing. In deeper waters, when it's more appropriate, make sure they're wearing either a life jacket or some kind of flotation device. If you're going to buy one, typically recommend ones that are listed as being Coast Guard approved. Those are usually the safest and best models. If you're going to be doing something more active like on a lake or a pond, water sports, things like that, another good thing to consider is a life jacket that has some extra flotation support around the neck and the upper back that actually will turn a child to keep their head up and out of the water, even if they're not actively trying to swim at the time. Some other things to keep in mind in the summertime: it's a great time to go bike riding. Make sure all kids, no matter what their age or skill level, are wearing a helmet whenever they're riding a bike. If you were to fall off and hit your head, if you have a helmet on at the time, it reduces your risk of a significant head or brain injury by nearly 85%. So it's very important to wear those whenever you're on a bike. Also, just make sure they're properly supervised, especially if they're going to be riding around in and around streets and things like that, and make sure they've kind of been educated on some proper traffic rules and things in terms of looking both ways and watching out for cars, etc. Another thing to keep in mind in summertime is the use of like bug spray or insect repellent. So make sure you're applying bug spray to your children when they're outside. It might be at risk for bites from mosquitoes and other insects. You can use that in infants 2 months and older, though if you're using it on younger children, make sure it has no more than 15% DEET, which is the active ingredient in most insect and bug repellents. Another common question we get in the summertime is related to ticks and tick bites. First, some things you can do to prevent. Again, using bug spray and insect repellent can help. If you're going to be in areas that have higher tick concentrations, so like wooded areas or fields with longer grasses, make sure you're wearing longer pants, boots, longer shirts, things like that can minimize your ticks getting on the body. Another is to continually just check your kids for ticks when they're coming in at the end of the day, things like that. Most tick bites do not involve any kind of transmission of diseases, things like that. A lot of concern during the summertime is for like Lyme disease, those kinds of things, but keep in mind that most ticks do not carry those, and it's usually not an issue. Typically for like Lyme disease, a tick has to be on the body for about 24 to 48 hours. So usually if you're checking periodically and getting the ticks off quickly, it should not be much of an issue. If you need to remove a tick, the most beneficial way of doing it is taking a pair of tweezers, grab the tick right near the base of the skin where it's attached, and pull gently but firmly upwards until the tick releases, and you can always make sure the entire tick has been removed. You do not need to save the tick or have it be sent for testing or anything like that, and that's come to us from infectious disease specialists at Children's and their recommendations. The biggest thing to watch for signs of tick, or if you were worried about Lyme disease, would be a fairly typical target or bullseye-shaped rash that can happen most often at the site, but can happen elsewhere. And a large percentage of people who do have Lyme disease do present with that in the first couple weeks, so that's something you can keep in mind. Hope you guys have a great summer. That's all I have for now, and we'll see you soon.